Hello, my name is Tara Trudeau, Clinical Manager for Shared Health ERS North Zone. And today's presentation is about how to fill out the registration of death. Registration of death is owned by Vital Statistics Manitoba, serves as a record of death of a person residing in Manitoba. Other zones have been doing this, and in the interest of standardization, we will be as well. It is also beneficial to our colleagues in the funeral homes. This needs to be order from the closest health facility to your station. The facility medical records department should be able to assist you. These forms are tracked per to location when they are sent. Registration of death. Used by EMS when patients are found deceased on arrival, DOA, when resuscitation is not performed due to a health care directive or other such documentation, or when resuscitation is discontinued on scene. The form is built very similar to a PCR, legal size with perforated top. Please do not separate the form or the perforation. There is an outer portion and an inner carbon copy. We do not require medics to take a photocopy of the carbon copy for our records. All we ask is that medics please document where the form was left. If the form needs to be left with an RCMP officer, for example, outdoors, please document the officer's name and detachment. This creates a paper trail if the form goes missing. Only specific sections of the registration of death are to be filled out by EMS. Other sections are completed by the funeral home physician or medical examiner. The registration of death is completed using black pen only. Before the body can be released for transportation or disposition, boxes 1, 4, 5, 29, and 30, and certification pronouncement of death section must be completed. EMS will complete sections 1, 4, 5, 30, and A and B of the certification pronouncement of death section. Section 29 is completed by the funeral director. If the information is available, the medic should also complete section 2 and 3. Section 1, last name of the deceased and all given names in full. The demographic information must be the legal registered information of the patient. If you are unsure if information provided to you is legal or factual, leave this section blank. Do not document Jane Doe, etc. This includes box 4 for sex. If unsure, the patient's Manitoba Health card will typically have the correct information. If still unsure, leave it blank. Section 2, if available, 6-digit Manitoba Health number. Section 3, if available, patient's age. Section 4, patient sex. Section 5, place of death. Fill in the name of the hospital where the patient died in the appropriate line, or fill in the city, town, village, or rural address of the place of the death. Rarely EMS use the hospital line. This example shows a town address as the place of death. Section 5, place of death. This example shows a rural address as the place of death. Make sure it is the actual address. Always leave the VS registration number box empty, as this is only filled by the Vital Statistics Manitoba. These sections are only completed by the funeral director and should be left blank by EMS. Section 30, date of death. Input the time of death pronouncement, making sure to check off AM or PM 12-hour clock. Input the date of the death, writing the month in letters followed by the date and year. Always leave section 31 blank, as this box can only be filled out by the physical physician or medical examiner. Certification and pronouncement of death. Section A, sign and print your name where designated and input your work address, input the time and date of your signature. Insert a check mark here as shown when this is the actual time and date of death. This checkbox is used in cases where resuscitation is initiated and discontinued on scene by EMS, or in cases where resuscitation would have been initiated but was not due to a healthcare directive or other document. Insert a check mark here as shown when this is the time and date of pronouncement. This checkbox is used in cases where the patient is found deceased on scene based on the criteria for determination of death. Certification pronouncement of death, section B, designated as certifier. Insert a check mark in the other specific checkbox and put paramedic on the line provided. Authorization from the physician is implied when patients meet standard criteria for determination of death or meet criteria for discontinuation of the resuscitation. Certification pronouncement of death, section CDE. These sections should always be left blank by EMS as they are to be filled out by the physician or medical examiner. Certification of event register section. This section should always be left blank by EMS as it is to be filled out by the event registrar. EMS should ensure that only the sections of the registration of death discussed in this presentation are completed, shown highlighted. We have laminated examples and sent them out to stations. If you still require one, please contact the clinical team. After determining that the patient is deceased, EMS should complete the registration of death as described in this presentation. Police are now in charge of the scene. EMS remain on scene until police arrive. Police may have questions for EMS on their arrival. When police have finished their questions, EMS may depart from the scene. Police will contact the medical examiner in order to release the body from the scene. The medical examiner may request to speak to EMS if you are still on scene. EMS does not need to wait for the ME to be contacted before departing as long as the police are on scene. If EMS discontinues resuscitation after the patient is loaded into the ambulance or while transporting, paramedics do not need to wait for police to arrive. The deceased must be transported to the closest ED. The paramedic will complete the registration of death and leave it with the deceased. In the facility, if the facility refuses to accept the deceased, contact Vectors for consult. EMS will leave the entire registration of death with the deceased. The entire form must stay with the body. Do not take the form apart. Page 2 is not a copy of page 1. EMS does not keep a copy of the registration of death. When the body is transported by the funeral director, the registration of death goes with it. Page 2 of the registration of death is then completed by the physician or medical examiner. When the call is completed, EMS should document all the events on the PCR as per normal procedure. Be detailed in the documentation of your physical assessment and treatment of the patient, and complete your PCR in a timely manner. If you have any questions regarding the registration of death or any other clinical topics, contact your clinical managers or any member of your leadership team. Thank you.